Well, we have new hope for sleep apnea sufferers. To tell us more today, we are joined by Dr. David Merrell and Shane Michaels in studio. So thank you both for coming in.
You're welcome.
So you're the sleep expert and you're the one who wasn't getting any sleep.
I was the snorer.
Okay. So I guess first of all, we'll talk about sleep apnea. Just explain to us what it is.
Sleep disordered breathing and sleep apnea is a spectrum of disorders including snoring, high upper airway resistance syndrome, and sleep apnea.
So do people know that they have it?
Most people don't. About 90% of sleep apnea or snoring and upper airway resistance sufferers are undiagnosed. And it's not until things get extreme or hugely impacts their life that they realize they need some help and they'll start looking for medical assistance.
So what sort of things should people look for? I would think when you wake up in the morning, if you don't feel rested, that's probably a good sign or a bad sign.
Well, you're right, but unfortunately it's not that simple. So a wide range of symptoms can be experienced by individuals, so it's not easy for them to know what 2, 3, or 4 things. It ranges everything from being tired, as you mentioned, but unexplained weight gain, fat and carbohydrate metabolism, headaches, diabetes, increased blood pressure, heart disease, cardiovascular disease. So a whole range of symptoms can be experienced by individuals and compromise their health, their work performance, things like that.
So Shane, what was your disorder? You said you were a snorer.
I was diagnosed as a moderate snorer. But I think the thing, and it goes back to what you were saying before, is as you grow older, you start snoring a little bit more and a little bit more. So you don't realize how much you're snoring unless your partner, which was my case, says, your snoring has gotten out of hand. I can't handle it anymore. I've got to go sleep in another room. And at that point you go, wow, I guess I really do snore, because you just get used to it as the years go by. And I think a lot of people go, yeah, I snore, no big deal. But then you stop snoring with one of these appliances and you go, wow, now I know what I was missing. And your whole life changes so dramatically.
So you mentioned all those symptoms. Where do you start? Do you see your doctor, or how do you end up with you, a sleep specialist?
Well, a lot of people will speak to their family doctor, but a lot of people are using the internet and the media that's available to them and doing research. So a lot of people come in that way and find out about their symptoms, and then they match it. Things like our website has a sleep assessment quiz that they can do. But a lot of people are self-referred, actually.
Right. Okay, so you'd mentioned that you now sleep with an appliance. Maybe just walk us through what these different things are. One's a little more intrusive. The other ones you could probably sleep with and no one would notice.
Well, I sleep with this particular item, but I'm sure Dr. Merrell could tell us a little bit more about exactly how it works.
So that's an orthotic. You just pop it in your mouth and go to sleep.
So there's the Canadian Thoracic Society, which is all the breathing and sleep specialists in Canada, have guidelines, and they talk about the 2 accepted treatments. So one is CPAP, which is a mask like this with a small air pump when room air is forced in. The other treatment is a dental appliance, and there are 2 examples here. So Shane's been using an appliance for about 3 years now, and we did his diagnosis with a home sleep test, arranged for an appliance to be fabricated, and then he was adjusted over a few months, and then we did a follow-up sleep study, and he reported back that he was feeling better, and then his wife reported less snoring. But then we do the sleep test as well to measure heart rate, blood oxygen levels, and things like that to assure we've got a good result.
But some unlucky person will have to wear the CPAP for a while. Can you start with one, and would you need it forever if you started sleeping with that?
Yes, this is like diabetes. It's a chronic disease. It only gets worse as we get older, so it's a lifelong set of treatment regimes that you have to follow. And there's millions of people in North America that are using CPAP, and it's becoming more common now for dental appliances to be used and being more accepted in the medical community.
For sure. And if it means you can get a good night's sleep and change your life, really, it's probably worth putting on your head at night. Yeah,
it can really impact your health and your job performance and your relationship with your wife.
Because you don't snore anymore. Exactly.
It's huge. And then you start talking to people and you realize how many people are sleeping in separate beds out there because somebody snores. It's a huge number.
So save your marriage too while you're at it.
Yeah.
So if you want a link for more information about the Merrell Clinic, that sleep assessment that you mentioned, you can find that on our website and just click on news links. So thank you so much for coming.
You're welcome.
My pleasure.
We're back right after the break.
What kind of egg?